Can you take complementary medications? A very common question that's asked. In my view, a complementary medicine is one that pays you a compliment, tells you how nice you look. My question is always, when these are being used by patients, is why? What symptom is it, or what characteristic is it that you think is not being met by your treating doctors? And I would encourage anyone who is contemplating the use of complementary medication, whatever that may be, to discuss this with their haematologist, really to get to the bottom of what it is that is trying to be sorted out. Most of these agents are unregulated. They don't go through Therapeutic Goods Administration scrutiny, and as such, one never knows what's in these tablets or potions at any given time. So being prescriptive or allowing the use of these agents is something that no doctor can do with any reliability. We don't know about interactions with other drugs with most of these, no matter how much work has been done, because there is no consistency in these agents. In particular, anyone who relies on these sorts of medications to achieve a response in their disease is, I think, deluding themselves, and I say that with some kindness, as I understand the difficulty that patients with these sorts of diagnoses may have. One has to ask the question why one would use a medication that is untested, unproven, and being sold at full price at profit against agents and treatments that have been tested, sometimes at a cost of hundreds of millions of dollars or more, with much science at the basis of their use. It's something that I often have difficulty understanding. Despite all that, I'm aware that many patients with cancers of all kinds will seek other forms of therapy. And as such, it is extremely important that you're open with your treating haematologist, or if you can't be with your haematologist, at least with your general practitioner, so that some understanding of what is actually happening to you may be arrived at if unusual side effects occur or unusual toxicities from your more normal myeloma medications are seen. I strongly encourage people to discuss these things with their haematologist, but to really question why they are sought in the first place.